Hello. So, guys, this is another series of videos that we are intending to do for our YouTube and channel, International Medical Graduates. We will be talking about safe prescribing, and I will be joined today by my dear colleague, Mr. Fesseha, who is a clinical pharmacist. He will be giving the whole presentation. I will be just listening. We have done the presentation together, but I will be just listening and asking questions in that video. All right, Binyam, over to you.
Thank you, Dr. Mina. Hello, guys. My name is Binyam. I'm one of the pharmacists in the West Midlands. So today we're gonna have an introductory about prescribing in the UK. So I'm gonna run through the legal requirements for medications in the UK, as well as the clinical how to clinically prescribe a medication to your patient. So we're going to start with the legal requirements. So in order to be able to prescribe in the UK, there's certain things that you have to do for the prescription to be valid. So those things are as follows, basically. So you got the standard legal requirements, and these are basically the prescription needs to have the patient's details. So this includes the patient's name, date of birth, and address. So if the patient has no fixed address, you can say NFA, which is no fixed address, and that's absolutely legal. If the patient is a child under 12 years old, then you have to write their date of birth as well as their age. Other than that, you need to have the prescriber's details. So your details, guys. So you have to write your name as well as your GMC number, and the prescription is to be signed and dated for it to be valid. Beside this, there's also special requirements for certain medications that can be used, and these are mainly controlled drugs. So for the people who will be working in hospital, I think the most important thing that you have to know is when you prescribe a controlled drug, it has to be written in numbers and words. What do I mean by that?
Do you mean as in characters, as in like?
Yes, characters.
Yeah.
So, for instance, if you are prescribing a morphine to your patient, then you have to specify the form of the medication. Is it tablet, capsule, whatever patch? So you have to specify that clearly, and you have to write how much you want to be dispensed. So if you want 100 capsules, you have to write 100 in numbers and within bracket 100 in words of whatever form of that tablet or whatever that medication is.
So let me just recap, Binyan, because I have done this mistake a lot of times, and I usually end up the pharmacist end up like chasing me to make the prescription in the right way.
Yeah.
So if I'm prescribing, for instance, 3 tablets of for instance, morphine sulfate.
Yeah.
I have to write 3 as in THREE.
Yes.
And I have to write I need tablets.
Yeah.
And if I need modified release, for instance, I have to write modified release tablets.
Yeah.
And otherwise the prescription will not be valid, right?
It's not going to be valid. So that's a legal requirement. It's not there to make your life harder, but that's a legal requirement. Every prescription for controlled drugs, mainly class 2 and 3 of the controlled drugs, need to be valid.
And I have another question. Yeah. How long will that prescription be valid for?
So in the UK, most prescriptions are valid for 6 months, except the prescriptions for controlled drugs, that's class 2, 3, as well as 4, and these are valid for only 28 days from the date they were prescribed. Okay. After that, it's not going to be valid, it's not going to be dispensed, and you will need to write a new prescription. Okay. So these are mainly the legal requirements that you need to know about prescribed medications here in the UK. Moving on, I'm going to speak a little bit about clinical appropriateness, and that comes under safe prescribing. So in order to help you to make the correct judgment when you prescribe your medication, and that your medication is appropriate to be used, there's certain resources that you can use, and they're readily available. You can use them from the internet, as well as you can have hard copies of them. So some of these resources are the BNF. And the BNF, there's two types of BNF. There's the BNF for adults and the BNF for children. So the BNF, you can find the BNF. So you can find the BNF anywhere. So you can just type in the internet BNF and it will appear. There's hard copies, so you can ask your hospital to give you a hard copy. As well, there's an app where you can download it from Android or iPhone, and you can use it. Basically, I think I put a picture of the BNF. So that's the BNF which you can use from the internet. So we just write BNF in the Google tab, and then this will appear. You can go for BNF for adults or BNF for children. Oh, sorry.
Sorry. I'll fix it on a second. Here you go.
Yeah. So there is BNF for adults and BNF for children. So the BNF for children. Sorry, guys, I'm just playing up with this.
So it's a bit sensitive, but yeah. Good.
Yeah. So the BNF for adults will be over there.
But we can't read it. It's just a picture.
Yeah. So the BNF will give you information about the indication. So a drug, what is indicated for. It will be mostly for the licensed indication. Also, it can put the unlicensed one, but it will mention that the medication is not unlicensed if it is not licensed. It will also give you information about the questions you have to take, as well as what to do if your patient has, for instance, renal dysfunction or hepatic dysfunction, and so on. It also gives you information about the side effects and a brief information about interactions. Other resources that you can use to help you to make the clinical judgment is basically your local guidelines, and these are absolutely number one resource that you have to use if you are working in the NHS, and this is mainly for antibiotics, as well as there's lots of other things that can be available within your trust's internet. And it's crucial, you guys, that you use these local guidelines. They can be slightly different from one hospital to another, depending on various things. So make sure in every hospital you work, you follow your local guidelines.
A question here, Binion, because this is something I wasn't aware of when I first started in the UK. The antibiotic guidelines do differ from one hospital to another.
Yes.
Right?
Yeah.
But if you can explain more, what would that be? Because I didn't understand that when I started.
Yes. So yeah, that's it's a bit confusing for some people. The reason is so when these antibiotic guidelines are being written, they are written by microbiologists, clinicians. So in every trust there is a group of, say, microbiologists, and they will assess the need of the antibiotic in regard to the indication in a specific area. So as you know, there is resistance issues with most of the antibiotics. So I remember I've worked in hospital before where we used a different medication from the hospital I worked previously to that.
For the same disease, you mean?
For the same. So we were using pivamycin for UTI, whereas the number one antibiotic was nitrofurantoin. So the reason being is because of the resistance. So the people in that region, they had resistance to nitrofurantoin. So the microbiologist decided that number one or the first treatment for UTI in that area to be pivamycin. So because of that, it's very crucial that you follow your local guidelines and just prescribe as per these guidelines.
Okay.
The other resource, which is also very useful, and you can find it readily in the internet, is the SPC, and that's the manufacturer's guidelines. So every manufacturer, when they produce their medication, there is an information they release. So that could be found in a website called EMC. So if you write on Google EMC, and then it will appear to you, and then you can write whatever medication is, aspirin, paracetamol. So the company that manufactured that paracetamol, it will give you lots of information regarding the appropriateness of that medication. So it will talk about its use in renal impairment, liver failure, pregnancy, breastfeeding, and so it also goes further than that in telling you the pharmacokinetics and pharmacodynamic properties of that medication.
I think this website is very important as well when you are trying to find the brand name or of a medication, or are trying to find what is that effective substance of that brand name.
Yes.
This is why usually I use this website.
Yes.
But all the other stuff you can find it on the BNF, right?
Yeah. So the BNF is number one resource. So if you have the BNF, well, 80% of the cases can be sorted just by using the BNF. If you need more information, obviously you can go on to using the AMC or the SPC. If you need further information about the use of that medication, say in renal function, then there is another resource that you can use, and that's the renal handbook or the renal database. So the renal database will require logins. That can be you can get that from your hospital, but the renal handbook is also readily available on the internet. You can download it and you can use it. I think we can also you can also use the MedCalc, which is very important. That you can
That's
use
for the doses.
it can tell you instead of calculating renal creatinine clearance for a patient or spending time in calculating the BSI and stuff. The app is very useful and very quick, and it's readily available as well for you. Moving on, guys. So we spoke about the BNF and how to find it. So that's the information that can be found in the BNF, the indications, questions, all the precautions that you can use, interactions, as we said, all the renal and liver impairments, doses, you can find it in here. We spoke about the local guidelines and why they can be different from one area to another, especially in antibiotics. So be watchful in these differences and make sure you always consult your local guidelines.
I think that's pretty much that sums up everything we wanted to say, guys. Thank you for watching our video. Thank you, Venia, for giving us this presentation. Guys, please give us a feedback. You will have a feedback link in the details, and let us know what kind of videos you want, and let us know if there's anything we need to improve or if anything specific you like about our videos. Thank you very much. Bye bye.